When we see a man with no hair, we usually don't think twice. But if a woman without hair walks by, it might surprise us. Even though 40% of people dealing with hair loss in the US are women, it's more accepted in men. Today we'll talk about what are the main 9 causes of hair loss in women. The number 1 cause is telogen effluvium. Telogen effluvium is when a lot of hair falls out suddenly. This happens because hair follicles enter a resting phase earlier than they should. It can be caused by things like stress, illness, or changes in hormones. And it often leads to noticeable hair thinning or shedding in women. Once the underlying cause is resolved, usually the hair starts growing back normally again. Telogen effluvium is like a pause button for your hair growth cycle. Normally, hair grows for a while, then rests, and then falls out to make room for new hair. But with telogen effluvium, lots of hair follicles go into the resting phase at once, causing a sudden increase in hair shedding. When these triggers happen, the hair growth cycle gets disrupted, and more hair than usual enters the resting phase and falls out. The good news is that telogen effluvium isn't usually permanent. Once the underlying cause is resolved, like reducing stress or recovering from an illness, the hair growth cycle usually returns to normal and new hair starts growing again. It might take a few months, but most people see their hair getting back to its usual thickness. Number 2 causes traction alopecia. Traction alopecia is a type of hair loss that occurs when there is repeated pulling or tension on the hair follicles. Traction alopecia is like a warning sign from your hair telling you that it's being pulled too much. Hairstyles like tight braids, ponytails, or extensions constantly tug on the hair, damaging the hair follicles. This can lead to hair thinning or even bald patches, especially around the hairline or where the hair is pulled tightly. The constant pulling damages the hair follicles, making the hair weaker and more likely to fall out. If the pulling continues, the hair loss can become permanent. It's essential to choose hairstyles that don't put too much strain on your hair and to give your hair breaks to recover. If you notice signs of traction alopecia, it's best to switch to gentler hairstyles and give your hair a chance to grow back healthy and strong. Number 3 causes alopecia areata. Alopecia areata is a condition where the immune system mistakenly attacks hair follicles, causing hair loss. It can affect women and men of all ages. Hair loss typically occurs in small, round patches on the scalp, but it can also affect other areas of the body. The exact cause of alopecia areata is not fully understood, but it's believed to involve a combination of genetic and environmental factors. The immune system attacks the hair follicles, causing them to become smaller and eventually stop producing hair. This results in hair loss in the affected areas. Alopecia areata can be distressing, but it's usually not permanent. In many cases, the hair grows back on its own within a few months to a year. However, treatments such as corticosteroid injections or topical medications may be recommended to help stimulate hair regrowth. Number 4 cause is chemical catastrophes. Chemical catastrophes typically refer to accidents or mishaps involving harsh chemicals, particularly those used in hair treatments such as dyes, bleaches, or relaxers. These accidents can occur when these chemicals are not used correctly or when there is an allergic reaction to them. When these chemicals come into contact with the scalp or hair, they can cause irritation, burns, or allergic reactions, leading to hair loss. Additionally, repeated use of harsh chemicals can weaken the hair shaft and damage the hair follicles, resulting in hair breakage and thinning over time. To prevent chemical catastrophes and hair loss, it's essential to follow the instructions carefully when using hair treatments. It is important to do patch tests before applying any new products to the scalp or hair. Consider applying essential oils instead of chemicals to support hair health. Look for the natural balms that contain these plant extracts, like argan oil, richness oil, myrrh essential oil, lemon essential oil, capsicum essential oil, and turmeric oil, as these are known to promote hair growth. Check out the natural balm in the description below, which contains all these beneficial plant extracts. Number 5 causes androgenetic alopecia. Androgenetic alopecia is when hair thins and falls out in a specific pattern, often at the top of the head or around the crown. It is often called female pattern hair loss, is a common cause of hair loss in women. In women, it can be related to changes in hormone levels, especially during menopause, or it might run in the family. Over time, hair follicles get smaller and produce thinner hair until they stop growing hair altogether. In androgenetic alopecia, hair follicles shrink over time due to the influence of hormones called androgens. This makes the hair finer and shorter until it eventually stops growing altogether. While it's more common in men, women can also experience it. Unfortunately, there's no cure for androgenetic alopecia, but treatments like minoxidil can sometimes help slow down hair loss and promote hair regrowth. Number 6. Cause is central centrifugal cicatricial alopecia. It is a type of hair loss that mainly affects women of African descent. It's caused by inflammation and scarring of the hair follicles. Before losing hair, someone might notice their scalp feels rough, flaky, or has small bumps on it. These changes can happen even before hair starts falling out. The exact cause of this is not fully understood, but factors like genetics, hairstyling practices, and chemical treatments may contribute to it. Over time, the inflammation and scarring damage the hair follicles, leading to permanent hair loss. It often starts at the center of the scalp and spreads outward, causing thinning and bald patches. Unfortunately, once the hair follicles are scarred, hair cannot grow back in those areas. It's essential to avoid chemical treatments and seek treatment early to prevent further hair loss. There isn't a cure for this alopecia since it involves scarring of the hair follicles. However, treatments aim to reduce inflammation and prevent further hair loss. Number 7 causes smoking. Smoking can contribute to hair loss in women because it affects blood flow to the scalp. Smoking not only affects the blood flow to the scalp, but also causes toxins to build up in the body, which can harm the hair follicles. This damage weakens the hair, making it more prone to breakage and fall out. Moreover, smoking increases oxidative stress in the body, which can damage the cells responsible for hair growth. This oxidative stress can disrupt the normal hair growth cycle, leading to hair loss over time. When you smoke, the blood vessels shrink, reducing the amount of oxygen and nutrients that reach the hair follicles. Over time, this can weaken the hair follicles, leading to hair thinning and eventual hair loss. Additionally, smoking can also damage the DNA in hair follicle cells, which further contributes to hair loss. Quitting smoking can help improve blood flow to the scalp and promote healthier hair growth. Number 8 cause is sudden weight loss. Sudden weight loss can cause hair loss in women because it can shock the body and disrupt the normal hair growth cycle. When the body goes through rapid weight loss, it can enter a state of stress, which affects the hair follicles. This stress can push more hair follicles into a resting phase, called telogen, where the hair eventually falls out. As a result, women may experience increased hair shedding or thinning. Additionally, sudden weight loss can also lead to nutritional deficiencies, such as not getting enough vitamins and minerals, which are essential for healthy hair growth. This further contributes to hair loss in women experiencing sudden weight loss. The number 9 cause is aging. As people get older, their bodies go through changes, and one of these changes can affect their hair. With aging, hair follicles can become smaller and produce thinner strands of hair. Additionally, the rate of hair growth may slow down, and the hair's natural color may change. These changes can lead to overall hair thinning or a decrease in hair density, particularly in women. Please check out our next video above titled, "What are the reasons for frequent urine infection in females?" Thank you for watching.